because we have different departments, and we have different profession who also, in one way or the other, contributed to the health work in the health sector.
Okay.
So, like ADME is one of the sector, the area of so we have paramedics, we have different people who also partake, not only the carer or the nurses that contributed to health and social work in health and social organization. So
yes, thank you. Anyone else?
I think
sector
in the area of specialism within the healthcare sector consists of how we care, how we listen to people we care about, their social life, and should, in case of the way, probably their personal upbringing, the way the both young and adults see life, and a little more about areas of interest for them that can keep them going and put them into activities for them or something. Yeah, thanks.
Yeah, thank you. Thank you all for your contributions. Yes. So what are the different sectors in health and social care? So we'll talk about them, and then we'll talk about what areas of specialism do I mean when I'm saying areas of specialism. What do I mean by that? So yeah, an area of specialism is basically where you specialize. So obviously, not all of us will be GPs, not all of us would be paramedics. So there'll be different areas, and different people are required in different areas. That is why it is so beautiful, the setup, because everyone is important. So the NHS is divided into primary, secondary, and tertiary care. We know about that. So primary care, the first point of contact, this is basically more or less the situation in other countries as well. So primary care, it's often the first point of contact for people. So if they're in need of healthcare, it's usually provided by GPs. So these are specialists. So a dentist, pharmacist, the NHS in England provides care free at point of use for almost 56.4 million people. And this, I think, is still an underestimate. There are many more also that might not fall into this data. So this might be a year old. So secondary data care is when it is sometimes referred to as hospital and community care. So when it is, sometimes it is planned. So what could be secondary care that is planned? Any idea? So you have a cataract surgery that could be planned. You might have a date for a planned cataract surgery. What else comes to your mind that could be planned? What else could you say might have a date, for instance, that you're going to have this appointment with the doctor and you're going to go through this procedure? Any comments?
Yeah, you're talking about secondary care, isn't it?
So you might go for women who have a uterus, they might have a hysterectomy.
I think it's end of life.
Okay.
End of life care.
Yeah, I was just talking about the beginning of life, and you've come to the end of life. Yeah, it could be the beginning of life, or the end of life, definitely, yeah. So you could have a planned end of life. It's called euthanasia when you do it yourself, but it's called physician-assisted suicide when there's a physician or a healthcare professional who is there to plan it and go through the process. It's not legal in this part of the world, but in some countries it is legal, where people tend to move there just for ending their lives. But starting your life, starting a new life, a cesarean section, for instance, it's a major surgery that a woman goes through when she can't deliver her baby normally, fetus normally. So she goes for a planned cesarean section. So that could be something that's planned, that's called elective, or it could be urgent or have emergency care, such as treatment for a fracture. So this you don't plan, because you don't plan an accident or a fracture. You should not be planning one. So if that does happen, God forbid, you would have an emergency situation. You'd go to the secondary care then. And what do we have with the tertiary care? It refers to highly specialized treatment. So you have neurosurgery. This is beyond the scope of the secondary care. So you have neurosurgery, you have transplants and secure forensic mental health services. So this goes beyond this. This is only the NHS, what I'm saying about, this is about the free care. So for people having fractures, you might have them so many in a day, all around, especially on weekends when you have children also who are prone to have lumps and bumps. So you go to the secondary care. That is the best place where you go to. And imagining that all of this is free is something that is understated. The importance of it is understated, because having free treatment for so many problems, and then thinking that there would not be any hiccups or any glitches in the program, that's really humanly impossible. So unless you are superhuman, then it's another thing, but we are humans, and then we have a certain capacity. Everyone has a capacity beyond which they cannot work. So then we analyze the different specialist areas within health and social care, what we are actually talking about today. So these are there to support people with a range of rare and complex conditions. They often involve treatment provided to patients with rare cancers. You have genetic disorders, or special medical or surgical conditions. They have this cutting edge care, and they're catalyst for innovation. So they promote new treatment strategies, supporting pioneering clinical practice in the NHS. So we look for pediatrics. We have geriatrics, which deals with the old age population. We have maternity, we have mental health, we have social work. So if, let's say, I am a pediatrician, I will not be able to see geriatrics, not with that confidence, definitely. But I am not, I'm not going to deal with these patients. In the same way, I'm not going to deal with maternity care. Mental health doesn't come under my domain. So there will be a specialist only in pediatrics or any of these headings. So they're there just for this specialist care, not for all. So the GP might see all of them, but a specialist will see only one of these. And then we analyze the different specialist areas within health and social care. So pediatrics, it's a large and diverse specialty. And as the name suggests, it's peds, it's children. It has high technology specialties such as neonatology. So this is neonates. Can anyone tell me what is the age for a neonate? Who is a neonate?
Neurology. New.
Did you say neonates?
Yes, I'm asking about neonates.
Babies.
Babies in the womb.
Those are fetuses. So a baby in the
Yeah,
womb
it's
is,
still in the womb. Yeah.
yeah, so that's a fetus. A neonate is something else. There's an
Oh,
infant.
really?
Yeah. So a neonate is under 1 month of age. So you have a specialist who will deal only with neonates, not with other peds cases. They'll not deal with children under 5 years of age or under 10 years of age. So they're only going to deal with children of less than 1 month of age. So once they're born to the age of 1 month, that's it. And when we go beyond that, it's called an infant. So 0 days to 1 year. So an infant will include a neonate as well. Okay. So, and pediatrics is always, obviously, it's children. So they deal with intensive care as well as community-based specialties such as neurodisability. So consultants are either, they'll be working in the hospitals, in general hospitals, community-based pediatricians could be there, or subspecialists, where you have, because peds, it's obviously just as the human body has a range of, could have a range of problems and disabilities, diseases. So you will have to have this understanding that a pediatrician would have to deal with these conditions also, or a neonatologist as well. So there's an endocrinologist and diabetes specialist who will then do, you have people who deal with neurology and nephrology. Nephrology is related to the kidneys, neurology is with the brain. Neonatology, respiratory medicine, pediatric intensive care, metabolic medicine, allergy, immunology, and infectious disease. So these are all the people who work either in any of these settings. So they might be general pediatrician, community-based pediatrician, or subspecialists. So these are subspecialists. And then gastroenterology, hepatology. This is gastro, the stomach, the intestines. Hepatology is the liver and nutrition. So you have palliative medicine, you have oncology. So an oncologist, a peds oncologist will work within this subsection. Neurodisability, rheumatology, emergency medicine, clinical pharmacology, and therapeutics. So you have all of these subspecialties within the NHS.
Are we all right?
Hello?
Hello, can hear you though.
Okay, you can hear me, but it's
I
like
think the
the
tutor is
tutor,
out.
yeah. It's,
The tutor is out.
let's wait for.
I think it's a network though.
Can you hear me? Sorry, there was a problem with my system. I just was thrown out of the meeting. Can everyone hear me?
I can't hear you.
Yeah, I'm sorry for that.
Yeah, we can hear you now.
Thank you.
Yeah.
Yeah, sorry. Okay, fine, thank you. Yeah, so okay, so we were talking about speed specialism, and then we have geriatrics. So geriatric medicine, it's the branch of medicine that's concerned all aspects when we consider older adults. So it's usually beyond the age of 65. So it's the largest medical specialty. So it works in a variety of settings. So you have the A&E, the medical assessments unit. You have acute care, rehabilitation wards. You have care homes and hospices. So care homes will not be there for, obviously, for children. They'll not be there for peds care, but then the others would be there for all other ages also. So they provide a patient-centered, compassionate, and holistic approach, and they work with GPs, other hospital doctors. They are social workers, and they have families and carers within their sectors. They help in diagnosis and management of acute illnesses as well as chronic disease, disability, and frailty. It's the part of their job. So what are the common procedures that they are involved in mostly? So it's performing comprehensive assessments of older persons, including mood and cognition, gait, nutrition, fitness of post-surgery, physical examinations where necessary, assessing a patient's ability for continuing care in the NHS or the community, and assessing the outcome of rehabilitation. All of these come under their interventions and procedures they are involved in. So then you have maternity care. So the maternity support worker, this is the front line of a family's journey through the journey that they have through pregnancy and first few days of birth. So what are their roles? So they'll help care for mothers and babies, make routine observations, update records and other admin tasks, educate parents one-to-one or in groups, take blood samples for testing. They could be all of these. So if they work, they could also work in postnatal wards. Sorry for that. Yeah. So they could work in maternity theaters, they could work in delivery suites, midwifery-led units. So there are people who are specialists in this sector, but not all will be doing everything. So probably one who works in the community in the postnatal wards might not be assisting in the community and vice versa. So it depends which specialism you have. And then mental health, it's people who live with mental health. They describe the huge impact that great mental health care had on their recovery and their lives, especially after COVID-19. There are many roles within the mental health profession. So you have psychiatry, you have occupational therapy, pharmacists, you can have nursing associates, you can have prison nurses, you can have mental health nursing, you can have drama therapists. So mental health, when we're talking about geriatrics or we're talking about pediatrics, mental health has a component in all of these. So you might have a diabetic patient who has problems who has mental health issues as well. So it's not something that can be set apart. So you would not say that a person who has cardiovascular disease might not have mental health problems. So mental health is actually it's a part and parcel of several other problems, unfortunately. So it might have a mental health toll on you. Might not, but more okay. So having said that, so there's mental health nursing that offers a high quality, meaningful clinical experience from nursing associates who support patient care and improve experiences of patients and carers. This they do it through registered nursing courses and those in advanced practice also. So mental health nurses have a wide range of skills that are important vitally to the running of mental health services. Then you have social workers who make a very big difference to individuals and families. They do this by helping them live their lives more successfully. So they work with families and others around them and with different client groups. So you might have people who work with elderly, you might have people who work with children with disabilities. You might have people working in the clinics with teenagers with mental health problems, young offenders, adults and learning disabilities, mental health problems, or physical disabilities. You might have refugees and asylum seekers who might be under social care workers, children who need to live apart from their families, foster carers, adopters, and children who are at risk of abuse or neglect or carers. They might also have specialists in visiting clients wherever they are, assessing clients' needs, organizing support, making referrals to other services and agencies, keeping detailed records, and attending meetings. So then we describe a range of health and social care professionals. So you have professionals such as doctors, nurses, specialist care, healthcare workers, social workers, social care workers. So what's the role of a doctor, for instance, if we say in primary care? So a primary care doctor might So, and then when we say that they prescribe and administer treatment within the primary care setup, they provide follow-up care for patients, refer them to other providers, and interpret their laboratory results. They maintain knowledge, skills, and performance. They take prompt action if they think that the patient's safety, dignity, or comfort is being compromised. They protect and promote the health of patients and the public. And they treat patients as individuals and respect with dignity. And they work in partnership with patients. They're honest and open and act with integrity, never discriminate unfairly against patients or colleagues, and never abuse their patients' trust which is in them, or the public's trust in their profession. What's the role of a nurse if we see in the primary care? So it's a profession within the healthcare sector that's focused on the care of individuals, families, and communities. So they may maintain or recover optimal health and quality of life. So within the primary care setup, we're not talking about the secondary or the tertiary care. We have nurses there, we have doctors there also, but this is just the GP setting or the primary care setup. So they're there to record medical history and collaborate with teams, and for patient care. They are there for advocating for health and well-being of patients. They monitor patient health and record signs. They administer medications and treatment. They're there to operate medical equipment, perform diagnostic tests, educate patients about management of illnesses, and provide support and advice to patients. Then there's a specialist in the tertiary care. So a specialist will be one that doesn't deal with the primary care conditions. They're there for the tertiary care setup where you have more advanced care. So you have oncologists there who are dealing with chemotherapy, radiotherapy, kidney dialysis. So you have all these specialists working within the tertiary care sector for advanced cases. And specialized services, they're not available in every hospital because they have to be delivered by specialist teams of doctors, nurses, and other health professionals. They should be having the necessary skills and experiences. So unlike most healthcare, which is planned, we talked about planned and arranged locally, specialized services are planned nationally and regionally by the NHS England. So for instance, you might not have a specialist in a town. You'll have to move to another city for a specialist to see you. And for instance, if there's using a patient's own tooth to restore their sight and hand transplants, all of these come under specialist care. And then we talk about healthcare workers. They help patients to move around, monitor patients, and perform basic health checks, make patients feel comfortable. This is actually the duty of every person within the healthcare setup. So this is a healthcare worker, basically. So this is what overall healthcare workers need to do. Wash and dress patients, serve meals, and help to feed patients. And who's a social worker? So that's a profession in which trained professionals are working. So they're devoted to help vulnerable people and communities work through challenges that they face in everyday life. What is the role of a social worker? To promote social welfare, help people from all backgrounds overcome the individual challenges that they are facing, advocate for social and economic justice, for members of diverse communities, embody the social work of code of ethics. So social workers work directly with children and adolescents. They would be working with the people with disabilities, students. Homelessness would come under them, medical patients, people involved in addiction, mental health concerns, refugees, immigrants, aging individuals, and couples and families. So what are the duties of a social care worker? So they might assess clients' needs, situations, strengths, and support networks to determine their goals, develop plans to improve their clients' well-being, help clients to adjust to certain changes and challenges in their lives. There may be several changes that they might be going through or challenges. Respond to crisis situations such as national disasters or child abuse. Advocate for and help clients get resources that would improve their well-being. They could diagnose and treat mental and behavioral emotional disorders, They can provide individual, group, family, and couples therapy going through difficult times, assess clients' histories, backgrounds, and situations to understand their needs as well as their strengths and weaknesses, develop a treatment plan with clients, doctors, and other healthcare professionals. Now we outline how access to professions is regulated. So what is regulation in the healthcare setup? So it plays a major role. So we have regulatory bodies. So we talked about CQC, Care Quality Commission, that was established in 2009. It's an independent health and social care regulator for England that's responsible for the registration, regulation, inspection, and rating of all providers. And there are 13 health and social care regulators, including the HCPC. So it's the Health and Care Professions Council. They are there to protect the public. So there are regulators within the HCPC that work within a range of specialisms. So they deal with all of these situations, and they're there to make sure that these specialities, subspecialties, wherever they're set up, they meet professional standards. And if not, they give their own directions then. There are different health regulators. So there's GCC, which is the General Chiropractic Council that deals with chiropractors. You have the General Dental Council, which deals with obviously dental issues. Then you have the Nursing and Midwifery Council, which deals with nurses and midwives. Their regulations are there. And then you have the General Optic Council. We've talked about basically all of these. And so General Osteopathic Council you have who deal with osteopaths, regulate osteopaths, GMC, General Medical Council that deals with regulating doctors, General Pharmaceutical Council regulates pharmacists, pharmacy technicians, Pharmaceutical Society premises, in the Northern Ireland, and Professional Standards Authority, PSA, the independent body that oversees 10 health and social care regulators in the UK. Then there's social care regulators, where you have Social Work England, that is an independent regulator for social work in England, Social Care Wales, that regulates the social care workforce in Wales only. Social Care Council regulates the social care workforce in Northern Ireland only. And then you have the Scottish Social Services Council that is responsible for this only in Scotland. How would you access profession? How are these regulated? So you have guidance there. You have the NICE guidance, for instance. It's an executive, non-departmental public body of the Department of Health in England. It publishes guidelines in 4 areas. So these 4 areas are the use of health technologies within the NHS and within NHS. They give clinical practice guidance. So any condition that the person suffers with, you have the NICE guidelines. You would want to go through the NICE guidelines for the recent guidelines. Guidance for public sector workers on health promotion and ill health avoidance, and guidance for social care services and users. It was set up as the National Institute for Clinical Excellence in 1999. And in 2005, they joined the Department of Health HDA to be the new National Institute and Clinical Excellence, an attempt to end the so-called lottery of healthcare in England and Wales. Treatment that were available depended upon NHS health Yeah. So yeah, you have the British Medical Association, which is a registered trade union for doctors in the UK. So this association does not regulate or certify doctors. That is the role of the General Medical Council. You have good practice, which also is dealt with. So it's the most simple explanation of good practice in health and social care would involve staff working in a way that puts the needs of the people they are caring for first. So it's a patient-centered approach. Poor practice is the opposite of good practice, obviously, in a nutshell. So earlier as well. So how access to professionals, professions is regulated. So we've talked about in detail before also. And then you have legislations, for instance. Legislations are always there wherever any practice exists. So you have the Health and Social Care Act 2012 that was introduced. That introduced the first legal duties about health inequalities. So it included specific duties of health for health bodies, including the Department of Health, Public Health England, clinical commissioning groups, and the NHS England that required the bodies to have due regard to reducing health inequalities between the people of England. The Act also brought in changes for local authorities on health, public health functions. You have the Equality Act again, 2010, which established equality duties for all public sector bodies, which aim to integrate consideration of the advancement of equality into day-to-day businesses of all bodies subject to the duty. You have the Social Value Act 2012 that regulates which include of service social value that have clear connections with efforts to reduce health inequalities through actions like you have improving in employment and housing, for instance, defining social value with reference to So just a few last bits left. So they define social value with reference to social determinants of health to help reduce local inequalities, improve health and well-being of local people, and in the longer term, reduce the demand on health care services and the services. So today we looked at the different specialist areas within health a range of health and social care is regulated. That's it from CAT. Any questions from again? Yeah, I'll see you same time. I'll be sharing the link in advance also. Thank you everyone for joining. Thank you.
You're
Take care.
Thank you for having us. Thank you for having us.
Thank you. Thank you.
Bye.
Okay, bye.